So usually what we try to do is use over-the-counter anti-acid medications in order to control it at the beginning, especially if it's a very mild form. There's lots of different medications, including Pepcid. There's anti-acids like Tums that can help, and there's another medication called Gaviscon that actually can help relieve mild acid reflux. However, if this is starting to happen for multiple days or it's happening over weeks, then we would recommend to go see a primary care physician who would likely recommend to start a medication. This particular medication could be something like Pepcid, which is famotidine, or a proton pump inhibitor, which is something like Prilosec, which is over the counter, or pantoprazole, which is Protonix, which is just kind of the sister form of what we call PPIs. These do not need to be on for long term. This will usually be used just to see if this relieves the acid reflux. However, if these do not relieve the acid reflux, then we would go ahead and send off to a gastroenterologist, who in turn would either try to increase the medication to get some relief, but at that particular time we would actually proceed with an upper endoscopy and go down and actually look into the stomach and into the esophagus. So if we do the endoscopy, there's two particular findings that are very characteristic of acid reflux. Number one is erosive esophagitis. So basically, the esophagus looks very inflamed, it looks red, and there's little erosions. That's a big sign of acid reflux. The other sign is something called Barrett's esophagus. So what Barrett's esophagus is when the lower part of the esophagus becomes the same mucosal type as the stomach. So basically, the stomach is one type of mucosal type that can handle stomach acid. However, the esophagus is a different type and it cannot handle stomach acid, and that's why you get pain. However, when you have Barrett's esophagus, this changes to the same mucosa as the stomach, so it's a protective mechanism of the body in order to handle gastric acid that gets up into the esophagus. However, this can be a precursor for possible esophageal cancer, and that's why there are certain types of risk factors that we look for in order to go down this route and to treat what's called Barrett's esophagus.